Blood doping is like having a team to carry out a robbery. You have a higher chance of success,
But
but
it's
it's still
still
very
very
illegal.
Blood doping can be a very complex subject, but we're here to inject you with some knowledge.
On a normal day, your body is producing a healthy amount of red blood cells. This gives your body the energy carrier it needs for your day-to-day activities.
When you exercise, your muscles have to work harder, which increases their need for oxygen. This is why your breathing and heart rate increase.
To help pull more oxygen into your bloodstream. As you exercise, the oxygen that reaches your muscles never leaves, but instead converts the available glucose into ATP, a molecule that stores and releases energy.
So what occurs when your body's oxygen levels get low, or when other systems can't deliver it quickly enough to your muscles? Your muscles begin converting glucose into lactic acid. Anaerobic exercise takes over, energy drops, and you begin to feel the effects of fatigue.
But here's where blood doping comes in. When you think about blood doping, this is probably what you're thinking.
But we're here to assure you this isn't the case.
There are 3 different types of blood doping: synthetic oxygen carriers, blood transfusions, and the one we will be talking about today, the injections of erythropoietin, or as we like to call it, EPO. In medical scenarios, synthetic EPO is used to stimulate the production of red blood cells in patients who suffer from hematological disorders, kidney disease, or anemia.
On the other hand, performance-enhancing EPO injections encourage their body to produce a higher count of red blood cells, and it imitates the action of the natural hormone.
Once released into the bloodstream, erythropoietin binds to receptors in bone marrow where additional blood is produced. The stimulation of red blood cell production increases the transportation of oxygen to your muscles, ultimately giving you more energy. This is because the increase in oxygen allows the mitochondria in your muscle cells to produce ATP faster during cellular respiration.
Although this sounds good in theory, the use of EPO does not come without risks. An increase in blood cells means an increase in blood thickness, causing the heart to have to work extra hard. Therefore, this can lead to blood clots, heart attacks, and strokes. If one continues to use blood doping, there can be a buildup of too much iron, so the patient can suffer from chronic fatigue, liver disease, and more. As you can imagine, these are all very unpleasant, but that's not all. Other side effects may include allergic reaction, fever, hives, or rashes.
And one of the most common side effects when using EPO is hyperkalemia, which is a potentially dangerous level of plasma potassium in the body. The body needs a very delicate balance of potassium to help the heart and other muscles to work properly. Too much potassium in your blood can cause deadly changes in heart rhythm, as the ever-important sodium-potassium pump can falter, causing the nerve impulses to be abnormal.
Did that scare you away from it?
On today's episode, we learned about EPO's effect on the body, the difference between using EPO medically and for performance enhancement, and the consequences of using this drug.
Tune in next week, where we'll be continuing the discussion of blood doping, focusing on blood transfusions.
And remember, blood doping, it's
not
not that
that dope.
dope.